have a couple of beautiful ladies here with us at this point. We have Bryn Hankins and Kim Chitwood, both with Mountain Valley Hospice, and we're going to be talking about Mountain Valley Hospice and all the wonderful things that they provide here for the community here in the area. So, ladies, let's just kind of start out a little bit of history of Mountain Valley Hospice. I know that's always good for folks to really know where the company came from, how it started, and how we got to be as big as we are here in Martinsville.
Okay, well, Mountain Valley Hospice corporate office is in Mount Airy, North Carolina, and they are co-joined by Northern Hospital and Hugh Chatham Hospital. And probably around 8 to 10 years ago, Mountain Valley Hospice bought out Patrick County Hospice. And then from there it grew, and we opened up an office in Martinsville. It'll be 3 years ago in April.
Wow.
And it has been such a blessing to the community, and it's been a very huge blessing to us also. We serve all of Patrick County, all of Henry County. We do go into Pittsylvania County and Franklin County. And then our Hillsville office helps to go inside of Floyd County also. And we offer hospice services in the home or anywhere that the patient calls home. And it's for end-of-life care. They typically have a diagnosis, either a terminal diagnosis or life-limiting illness, to where there's a possibility that they may not be here in 6 months. And so that's basically what would qualify them. We do work under Medicare, which means that anything that, whatever Medicare stipulates, that's what we would do with any patient regardless of their insurance. We do accept all kinds of insurances to cover the hospice care, and we also accept patients as long as they qualify for hospice services. They will not be turned away regardless of their inability to pay.
And so, how can folks get involved with hospice? Say they have a family member that's really kind of in a bad situation physically, and they may need hospice care. How can they get involved with it?
They can simply call the Martinsville office or the Stewart office. They can have their doctor to contact us. We do not have to have a doctor's order to go out and do a hospice consult. That's a non-billable service. It's just something we provide. So then Kim or myself would go to wherever they call home, or if they're in the hospital or facility, and we would meet with the family by the bedside and go over medical records and just make sure they meet that Medicare requirement for hospice. That said, maybe they're not exactly a hospice appropriate. We have other programs that we can offer, such as palliative care. Say they still wanted to seek aggressive treatment, they weren't quite ready for hospice. Then we can do the palliative care. We can manage a symptom such as pain, nausea, vomiting, just different symptoms that we can manage through our nurse practitioner.
Now, does palliative care fall under the same guidelines as hospice care as far as insurances and things of that nature?
It's still covered under their Medicare. It's just that they are still allowed to go to the doctor, to go to the hospital to seek that aggressive treatment. Our nurse practitioners just simply going in and helping to manage those symptoms that may come along because of the chemo, the radiation, or the illness itself, just so that they can remain in their home, wherever they call home, and they can be comfortable, but yet they can still actively seek that treatment. So they don't necessarily have to be have an illness that would be taking 6 months. It may be that they're wanting to still seek that treatment. They're not ready for hospice. And then we do have another program that if they're not hospice appropriate, called transitions. And that's where a social worker would go in and kind of follow that patient and just monitor the patient. And then when they do become hospice appropriate, then we can switch them into hospice.
Now, what are some of the myths that folks out there may have when they hear hospice and hospice care? What are some of the issues that you have to deal with?
Well, one that I always hear is, oh, hospice is going in, they're going to start the morphine, they're going to die. The comfort kit that contains medications to help keep a patient comfortable based on keeping their agitation under control, their nausea under control, their vomiting under control, and definitely keeping their pain under control. The doses of morphine that hospice uses is not something that would cause them to stop breathing. It's not something that would cause them to die. It's the disease process itself. The medications that they get are often given by their own caregivers or their family, and their family is educated in what medications to give and what to give the medications for. The morphine medication, it is a liquid typically, and it's a very small volume. Basically, all of us have given children liquid ibuprofen or liquid Tylenol. It's very similar to that. It's that small of a volume. And it's usually only around 5 milligrams, and that's not enough to cause any harm. And what it helps to do is a lot of times we see patients that are having difficulty breathing, and morphine is a wonderful medication for that. It helps to relax those muscles in between the ribs and just helps to relax them, but it would not cause them to pass away. Another myth is, well, hospice is coming in, they must be close to dying. That is not necessarily true. Hospice does get called in earlier than it used to. I can see a big difference in the past 5.5 years since I've been in hospice. Sometimes we would get called in within hours and they would pass. Sometimes before I could even finish a consult, they might pass, or within a week or so. But now I think as the community and the doctors, everyone's getting more educated about the benefits of hospice, we're getting called in earlier. And when we get called in, they've actually done studies that show that hospice patients live 20% longer with hospice than without it. And a lot of that has to do with we're keeping them comfortable. We're giving them helping them to ensure a better quality of life for them. And anytime the quality of life is better, the will to live or the will to just be better goes along with that.
And some people actually graduate,
They
for lack of
do.
a better term, they
They
graduate
do.
from hospice because they've improved so dramatically that they no longer need the hospice services.
Especially those patients that may have Alzheimer's or dementia, and they kind of used to be an old term that was called failure to thrive. Now it's protein, calorie, malnutrition. But if you have a patient that maybe is not getting that one-on-one care, and then they're all of a sudden getting that additional support system, and they're eating better, they're feeling better. It's not that they weren't getting good care before, but they're getting an additional set of eyes and ears for the doctor, and they're having that extra bit of spiritual support from our chaplain going in, our social worker going in and visiting. So some of those patients do turn around and they do graduate, and that's when they're put in that transitions program, that non-billable service. And a lot of people, like Kim was saying, thinks morphine will take you out. Well, you can actually overdose on Tylenol a whole lot quicker than you can on morphine. So it takes a large quantity of morphine to actually overdose.
So a lot of misconceptions there among folks that may not really be educated enough about what
Right.
hospice really is.
And then another thing is they'll think, well, hospice is coming in, they're just going to stop all their medications, and that's going to cause them to pass away quicker, and that's not so. If we have patients, if they're taking high blood pressure medications, they're taking their diabetic medications, certainly we want them to continue those because that's going to help to ensure a better quality of life. Times and instances where we would recommend maybe not taking those medications, if they're not eating very much, they probably don't need their insulin. They probably don't need their metformin, their diabetic pills. That may do them more harm than good. If their blood pressure has suddenly dropped and they're not needing their blood pressure medication, or if it's a situation to where they cannot safely swallow the medications, that would be the instances where we may make some recommendations in changing their medications around or stopping some medications.
And you certainly work very closely with their physicians
Exactly.
and keep them apprised of exactly what's going on in these
Exactly.
situations.
They're very involved.
And once again, it's patient choice, and that includes the family. And anything that our team does, it's not just the patient that's involved, it's the entire family. We believe in taking care of the family just like we're going to take care of that patient. And one thing I wanted to make sure that our viewers or your viewers know is that we take care of kids. We hear more and more that hospice agencies aren't taking care of children. They're not seeing patients that are pediatric patients. We alone in our offices have had 4. We've had 2 babies, a toddler, and a teenager just this year alone. Our medical director out of Mount Airy is going into a territory that we don't service simply because he's seeing some children that no other hospice agency would take. We ourselves out of the Martinsville office, we serviced an area that wasn't in our spectrum, but it was through one of our sister offices that we were able to see a baby through our Pilot Mountain office, but it was actually our Martinsville team that took care of the baby because it was closer to us, because hospices in that particular county wouldn't see the baby. So while it may be hard for nurses and for aides and anybody to deal with a child or baby that you know is going to pass away, it's something that we feel we need to do. We need to serve those families. We need to serve those infants and those toddlers. And
they need as much support as anyone, for sure. In some cases, probably more, being that it's a young one like that. For sure.
So we encourage other hospices to kind of start doing that as well. You know, take care of children and babies and teenagers, because while it's very, very hard to do, it's hard to deal with anybody that knows they're going to be passing away. It's hard to lose any patient as a nurse or as a social worker or as a chaplain, any of the team members. It's hard, but it's just an important aspect that we need to incorporate in all hospice agencies, that you take care of children.
Well, you've mentioned team a couple of times. Let's talk about the team and the group of volunteers and folks that you have that work with Mountain Valley Hospice. Let's talk about those people, because you guys are very caring, wonderful folks, and I know the staff that works with you guys, it's got to be that have that same characteristic.
We do take a very team-based approach. We have a nurse, every patient assigned a nurse, a social worker, a home health aide, a volunteer if they choose. They can actually have pre-bereavement, and they also, I think that's, is that all? That's the nurse, the home health aide, the nurse, the chaplain, and the social worker. That's the four main bodies that see them, and then if they choose to have a volunteer to kind of come in and just kind of sit with them. But one of the biggest wonderful things that we offer are our CNAs. They're absolutely wonderful. They're the heart of hospice. They go in and they help to care for the patient, and sometimes it is very difficult for the family to give baths to their mom and their dad or their family members, so this is something that the CNA helps with, and it does kind of help to give the family members and the caregivers a break also. As far as our bereavement, we do offer pre-bereavement, so that if anyone is having a difficult time, including the patient themselves, with their impending demise, the bereavement counselor can go in and talk with them. And a lot of times we do find that it's much easier for them to talk to a stranger than sometimes it is to talk to a family member or their own friends too. And then our bereavement counselor will follow them up to 13 months if they'd like for that after the patient passes.
And I think that's a very important aspect that folks out there need to understand, that hospice is not just about the patient itself. It's about the family and everybody that's involved very closely with this patient.
Right.
And you guys, you know, like you said, with the pre-bereavement and post-bereavement parts of this, you guys have folks that can come out and just at least talk with the family members and help them as well.
Right. And we are always looking for volunteers, and we do have a volunteer class coming up in November out of the Martinsville and Stewart offices. And our volunteer classes used to be 2 solid days, usually like a Tuesday and Thursday during the week, but a lot of the training they can actually take online so that it can be more convenient for the volunteers. And if they're interested in that, they can please give us a call at 403-4764 for more information on that.
Cool. Well, thank you, ladies, for being here this evening. I certainly appreciate it. If you know someone out there that could benefit from hospice care, please give Mountain Valley Hospice a call. They're wonderful folks. They would be more than glad to come out and talk with you and your family and help you through this difficult time.